Hey everybody, my name is Rob Drenning. I'm a physical therapist. In this video, we are going to talk about what to do when you throw your back out, what that means, and how you can help get yourself out of that, because it's something, it came up a lot for me in the clinic this week. It's something that a lot of people deal with. Over 80% of us are going to have back pain at some point in our lives. So this is all stuff that we need to know. And it's a little counterintuitive what you might think to do. So first of all, what does it mean to throw your back out? It sounds really terrible. If you've ever had it happen, what I'm talking about is that you bend, you move, and that bam, that stabbing, sharp ice pick kind of pain right in your back. You're stuck, you can't move. On a 0 to 10 scale, it's a 15. It is up there. It is so painful. I did it once picking up a lampshade, and it doesn't take much force to do it. It happens a lot. So that's what I'm talking about, is those real sharp, acute episodes of back pain that suddenly everything hurts and you can't move. Now what do we do? Okay, the good news is that despite how high that pain level is, we know from a lot of MRI studies that that doesn't mean that there's actual structural damage in your back. Most of the time, nothing's broken, nothing's torn, nothing's out of place. It feels like it is with that intensity of pain, but we know that usually that's not the case. So that's important to keep in mind. When everything hurts, it's okay to do some of those motions because you have to, because we know that usually there's no structural damage to any of your tissues in there. That's a really important qualifier. So what happens then? Why does it hurt so much? Most of the time, there are joints in your back called facet joints that have to glide like this. That's how we move. Sometimes they stop gliding and they just push together. There are little nerve endings in there, and when that happens, that pushes on that nerve ending, and bam, that gives you that stabbing pain. Okay, then all your muscles around there tighten up and lock up, and suddenly you can't move. Every movement hurts, and you're almost kind of stuck wherever you are. Okay, I'll make another video showing you how to get up from the floor and get in and out of bed, do things like that when you have that severe back pain, because that's something I see a lot is you're hurting, then you're down on the floor, then what do you do? Okay, but that's what throwing your back out means. It's a little bit of a misnomer. Nothing is actually out of place, nothing's damaged, nothing's torn, despite the fact that it feels like it is. It's usually joints that aren't gliding and muscles that are then spasmed up around them. So what do we do? How do you get out of that episode? Because nothing's damaged, the first thing to do, and the most important thing, I know it feels the best to just lay in bed and not move, but you absolutely can't do that. You have to get up and out of bed. You have to move as much as you can. That might mean walking up and down the hall, just moving around your house. I'm not saying you have to go walk around the park, because you're not going to be able to do that. But the number one thing to do is to avoid laying in bed and stay as mobile as possible. Have a spouse or a partner help get you up, walk around the house. Usually it's the type of thing you walk a little bit, that'll start to hurt more, then you have to sit and lay down or rest. That's okay. Just keep doing that. Don't take the most comfortable position and just not move because it hurts. That will be worse for your back than moving around a little bit. It's okay to feel it a little bit because nothing is damaged. That's an important qualifier. Okay, so number one is move as much as you can. Number two, ice and heat. Usually in an acute injury, like when you sprain an ankle, ice is the recommended thing, but in the back, it's a little bit different. You can use either one of those and use which one your body responds best to. A lot of people will like to alternate back and forth, ice for 15 minutes, heat for 15 minutes. That's okay to do too. Just make sure that you let your skin get back to room temperature before you go to the other one. In other words, if you have the ice on there, don't put the heat on while your skin is still cold. Okay, and that's okay to do. If one really works better for you, a lot of times it's heat, then use that. You can do it as often as you want, every hour or two. You can't overdo the frequency of those things. So keep moving, use ice and heat. Three, when you're sitting, keep something behind your back for a little extra support, a large pillow, not the little lumbar rolls. Those aren't enough. Something that's going to keep you really up straight. Those transitions from sitting up to standing are really painful when you have a back injury like this. And if you keep some support there, it maintains a little bit of the curve, and it just makes that transition a little bit easier for you. So it takes a little bit of the edge off when you're trying to get up and out of the chairs, especially if it's a low recliner, couch, something like that. So stay moving, use ice and heat, and keep some support behind your back. And the fourth thing is, what about exercises? When everything hurts, what can you do to help speed up the process of getting those joints moving and the muscles to relax a little bit. I'm going to show you 2 things that we can do. Let's go do those right now. Okay, so I'm going to show you 2 exercises now that you can do when you throw your back out when you're having that acute episode of back pain. We just talked about how movement and staying mobile is important, and the same goal applies to our exercises here. We want to just create a little bit of movement that's comfortable and pain-free. It's going to help circulate some fluid in and out of all of our joints, get them gliding again, and get the muscles to just relax. So these have to be pain-free. I'm going to show you first laying on my side. The only reason is that that's the easiest position to get into when you have a back pain episode. You can be on a bed, a couch, it doesn't matter. You don't have to be on the floor. I understand that that's extremely painful to do, but whatever surface you can be on, that's going to be your best starting point. So what we want to do is first getting down on my side. I'll show you here. All you're going to do first is you have a pillow probably to support your head. And you're just going to gently let your shoulders roll back like that. Just nice and easy. If you need to, put a pillow between your knees, but you're just going to let your shoulders roll back gently, nice and easy. You don't have to go as far as you can. It just has to be repetitive movement back and forth, and it has to be pain-free. So all you're doing like that is just getting a little bit of rotation movement to help those joints start to glide again. Okay? You're going to do that about 20 times if you can, 30 even better. They're easy, they're comfortable, they're pain-free. Okay? Then what you're going to do on your side is, it's called a pelvic tilt, but basically you're just going to round your back out and arch your back. Round your back out, flex, bend the back, arch your back. You're going to do that in a real small, comfortable range of motion. You're just going to go back and forth nice and easy. Round your back out, arch your back, extend the back. Whatever range is comfortable. It doesn't have to be as far as you can go. I know I sound like a broken record. It just has to be pain-free. You can do the same thing on your back. I'll show you that now. If you're on your back, the rotation just looks like rocking the knees. And I'm only doing it a real small range here. I'm not going as far as I possibly can. I'm just doing a nice, easy movement back and forth. It's got to be 100% pain-free. And then the other motion would be flattening your back down into the bed or the floor, arching your back off, almost like if you were going to slide your hand underneath there. Then push your back down into your hand, and then let it arch back off your hand. Nice small range, nice and pain-free. Those are the 2 movements that you can do to help get the muscles to relax and the joints gliding. And like I said, 20 to 30 reps. You can do these every time you get to be laying down. We talked about not laying down all the time. You get up, you walk, you move around. When you go back to laying down, do them again. The more often you can, the better off you'll be to help get yourself out of that acute back pain episode or throwing your back out. Okay? I hope that makes sense. So just a quick recap. Even though it feels like you don't want to, keep moving as much as you can. Use ice or heat for 15 minutes every hour or 2 if you want. Sit with something behind your back, a lot of extra support. It'll make those sit to stand transitions a lot easier. And for these 2 gentle movements. The episode of back pain, it's sharp, it's severe, but usually they don't last long. And if you do these things, you'll speed up your chances of getting out of it a lot sooner. I hope that you find that helpful. Please let me know if you have any questions, how it's working for you. If you're dealing with one of these now, I know how much it sucks because I've done it myself. So let me know how it's going for you. Thanks for watching.